Welcome to On Call, Paging the Frontlines of the Future, a podcast powered by Project Unity. I'm Hargan Satchar, your host, and a proud member of Project Unity, a student-led initiative transforming how we talk about healthcare. At Project Unity, we believe meaningful health innovation begins by listening, not just to professionals, but to young people living and leading within today's health systems. This podcast brings youth into dialogue with experts across medicine, public health, and digital health to explore real stories, pressing challenges, and bold ideas, reshaping health equity in schools, clinics, and communities. Whether you're a student leader, an educator, or a healthcare professional, you're in the right place. This is where emerging voices and experienced minds come together to reimagine the future of health. Our guest today deeply embodies that mission. Jadon Gamboa is a rising senior at the University of Southern California, majoring in health and human sciences with a minor in healthcare studies. He's on the pre-med track, but his work goes far beyond academics. His passion lies in reimagining what healthcare can feel like when connection, empathy, and culture are placed at the center. As Director of Internal Affairs at Project Unity, Jadon helps guide student-led initiatives that elevate youth voices and foster inclusive spaces for collaboration and change. His passions span from mentorship and research to community engagement, and he's constantly exploring how our relationships and lived experiences shape well-being. Jadon, we're so excited to have you with us today. Welcome to On Call. Where are you joining us from?
I appreciate you for having me again. Thank you so much. This is a lot of fun. I'm calling from Cleveland, Ohio. Shout out to the
Awesome.
216.
That's so cool. All right, let's dive right in. So, we'll start a little bit with your personal journey. What first inspired you to pursue healthcare, and how did that evolve into your focus on empathy, culture, and connection?
No, yeah, this is an amazing question, and a question I always think about, especially going into medical school and even before that as well. But for context, my mom was a nurse, like a lot of Filipino moms highly respect nurses. And if I had to give an advice right away to anyone in healthcare, always respect your nurse. Always, always, always. But because my mom was a nurse, I grew up in a hospital. I grew up inside the clinic, not like being taken care of in the clinic, but like seeing how clinics worked and operated. And I remember myself just running around the clinic as a child, me and my sisters and my siblings. Any like empty exam rooms we would just hang out in, and holiday parties, stuff like that. So healthcare was already established right when I was born.
Mm-hmm.
And so I knew going into college and other aspects and throughout high school, I knew that I wanted to continue in healthcare because it was already a part of me at the start.
Mm-hmm.
And so, in learning about healthcare, more and more about the ins and outs and kind of the tough material, I noticed just this lack per se of, I guess, learning about actually the patient experience
Mm-hmm.
and learning about what it truly means to be a doctor. Because growing up seeing the clinic and knowing doctors throughout my entire life, I really saw the genuine side of things. And I'm very blessed to be surrounded by, I guess, people that I now call mentors in this field. And the one thing that sticks out about them is how genuine and empathetic and
Mm-hmm.
compassionate they are. And I just saw that lacking, and it made me truly want to explore more. And the more I explored in fields of empathy, culture, and connection, and just the human experience, I saw that lacking behind just a wall of pure sciences. And don't get me wrong, like the sciences are amazing. Like I'm a nerd myself in the sciences, and I geek out about the weirdest things sometimes. But again, it felt empty, and it felt something that was holding us back as a field. And I think that's my origin story, if you were to put it like that.
That's awesome. Thank you for sharing. We can clearly see that you've taken that and even gone further than just your academic passions in the clinic. So, you've spoken about chasing a future where care feels personal. How do your studies, experiences, and role at Project Unity reflect that mission?
That's an awesome question, by the way. These are all great questions.
Making me think.
No, yeah, for sure. I'll start off with my experiences, and I want to focus on what you said about the phrase care feels personal. And I think where I To be honest, I didn't really get that through my studies and any of the core academic stuff.
Mhm.
Where I got that was through my experiences, and some of those experiences weren't even clinical per se. I think one of the biggest experiences that kind of shaped the whole idea of care feeling personal was actually through marching band, which is a very band kid thing to say. Yeah. So looking into marching band and looking into how marching band is set up, it's a very team but also individual aspect. And
Mhm.
I'm very fortunate enough to be the section leader of my section in the band at USC. And in that role, you really genuinely create connection
Mhm.
and create connection beyond what is even comprehensible.
Mhm.
And I think where that connection starts, it truly does create that personal feel to actually being cared for and actually being taken cared of. And I truly believe that that experience in band allowed me to apply it to other items like my studies and like other experiences in volunteering and shadowing and learning
Mhm.
about the whole ideas of empathy and stuff like that. But most importantly, it did translate into my role into Unity for sure, and making sure that I'm actually making a connection with these
Mhm.
people beyond the work being done. And I truly believe though, like once you make that connection and once you make that work feel personal, the work has so much meaning to it and so much power
Mhm.
that you can go on and on with the work. I think that's what really gets me fired up about healthcare is I truly feel that I made that connection and I made that this whole process feel personal.
Mhm. Well, that's incredible. Thank you so much. We can see that you care deeply about the intersection of healthcare and culture. So, we'll talk a little bit about your design for equity. What does it mean to build an empathetic system, and how can students like us help lead that kind of change?
No, yeah. Another great question for sure. I think the one thing about building empathetic systems is you always have to keep thinking about it because things like empathy, things like culture and the values within that, they're forever changing and there's not one fits all.
Mhm.
I'm currently doing work around SDO8, social determinants of health, and we're analyzing how questionnaires, how they're very different between hospital systems throughout the country. Sorry, my dog just saw a
Or
raccoon outside, probably. Um, what was I saying? And how different each hospital system has their own different questionnaire,
Mhm.
and how that limits kind of what's the word? It limits had
Like fluidity, if you
no,
will.
yeah, yeah, exactly,
Mhm.
exactly. And we're trying to figure out some way, more so like a tool per se, and evaluating where can we achieve that fluidity and stuff like that. So
Mhm.
that's my on my personal end first, but more so on general empathetic systems. And I like to think about these systems as a football team per se. If you try to create an empathetic system where it's a one size fits all, you're not going to achieve anything. And I to the analogy of football teams that are one sided heavy, let's say on offense or defense, do not make it far. And
Mhm.
I clearly saw it as a USC fan 2 years ago, so it's very apparent to me. But the more successful teams, if you look at a football team, it's not only two separate teams, so offense and defense, but there are multiple teams within offense and defense. So for offense, you have your quarterback room, your wide receiver room, running back, offensive line. I can go on and on. How you create empathetic systems is finding some way to connect these different and distinct teams into believing one cohesion and purpose. And I think it truly starts with yourself. It's it's very hard. I remember seeing this quote and saying, "You can't solve every single problem in the world," which
Mhm.
seems very grim and sad. But if you think about it in the reality of things, it's kind of true. And the only way you can truly change every single problem in the world is if you start with yourself. And I think that's where students can help lead that kind of change and figuring out how you can solve the system within yourself, which is
Mhm.
very deep in saying, yeah, I think it does really start with yourself for sure.
Awesome. That's incredible perspective. Thank you for sharing.
Yeah.
So further, how do you see the role of storytelling and listening in shaping better health care?
I love that question, by the way. I'm a huge believer in narrative medicine.
Mm-hmm.
Uh, I I hope to continue in the field of narrative medicine um, in the future. To your point of storytelling and listening, this actually I just watched. Do you know the film Patch Adams? Does that movie?
I have heard of it. I have not watched.
Okay, for the audience out there, Patch Adams. I'll give the Spark Notes summary of it. Patch Adams is a Robin Williams film. And in that film, Robin Williams is a doctor without a license, which
Okay.
is
Interesting.
crazy for
Yes.
sure. But what in that movie, little spoiler, in that movie, what makes him so successful is his ability to share humor and storytelling and actually listening to patients. And it truly sets him apart from other like doctors in that field. It's a big exaggeration in the movie, but just that idea
Hmm.
of story that question really reminds me of that movie. And so how I see the role of storytelling and listening, um, I think it truly plays in part again to forming a connection
Hmm.
and understanding the person that's in front of you. Not even a patient,
Hmm.
sometimes even faculty.
Hmm.
And yeah, it truly it sets two things. So thing the first is again it makes the process personal,
Hmm.
but also beyond the work it connects you to a bigger picture, and it often takes the load off, if you get what I mean. It causes you to take home something home with you,
Hmm.
seeing patients and seeing other people less as cases and more as stories. And
Hmm.
I truly believe that if we go beyond looking at an individual less of a case and more as a story that shares
Hmm.
more meaning and shares more power, I
Right.
think that's where so so many health outcomes, so many positive health outcomes come on. And
Hmm.
it truly does again create connections with people for sure.
Awesome. Thank you. Now we'll talk a little bit more about your role in leadership and the future of systems. So, as someone who's helped shaped Unity's internal structure, how do you view the role of behind the scenes leadership in building a strong mission?
Yeah, I gotta think about this question for
Sure, no
sure.
worries.
No, yeah. So before answering that question, I want to touch on culture real quick because I think
Sure.
that whole question encapsulates what culture is. And we often think of culture encompassing the entire picture, so patients and providers included. Oops, sorry. My like internet is cutting. Am I back now?
Yes, you're good.
Okay.
No
Gotcha.
worries.
Okay. What was I saying?
You're touching on
So
culture.
culture. Yeah. But we often forget about like subcultures within that big picture culture. And
Hmm.
I think you can't achieve a strong culture
Hmm.
and a strong mission specific to your question and if you don't have a strong sense of subculture within your leadership. And I'll use my passion of this issue that I have in mind. I truly believe that we have an issue in healthcare, provider to provider wise.
Hmm.
And let me explain more. So often we don't realize how burnt out, how stressed, how I guess no, yeah, stress is a really good way in encapsulating it, but we don't realize the toll that doctors take in order to care
Hmm.
for people. And I think that's what truly makes this profession so respectable by
Yeah,
patients.
for sure.
And if you don't have strong doctors, how can you have a strong mission and strong final outcome in providing for patients? And I truly believe that all this behind the scenes work, all this work that's not seen by patients and not seen by the outside world,
Mhm.
if that's not strong, you're not going to have a strong mission and strong final outcome. And again, it all starts with culture and creating a culture where wellness is seen as the most utmost priority. So obviously first the patient is the priority, but
Mhm.
second to that is the wellness of your provider.
Mhm.
So
Sure.
I think that's where we can improve on that for sure.
Awesome. Thank you. That's a great answer. So, a few reflection questions before we close.
Hmm.
What's a specific ideal that you've reevaluated about healthcare or leadership in the past year or more than the past year?
Oh gosh. That's a big load of a question for sure. Can you say that one more time, actually?
What's something that you may have reevaluated about healthcare or leadership recently?
Mm.
Maybe like a technique or
Mhm.
skill?
Okay, I'll touch on this because this is something I've been thinking about lately. So, something I've reevaluated is how much social media hurts to the whole process of becoming a doctor and applying to med schools even. There's a whole picturesque that you have to achieve in order to become a doctor is what social media says. And reevaluating that process, you kind of realize that what's being put on social media is kind of what worked for that person. And I truly believe that what worked for them may not work for you. And it kind of shows how much this process, and I truly like I'm feeling it right now, is much more on myself.
Mhm.
Um, I think I kind of stop. I try my best not to go on med school
Right.
TikTok for you page and horror stories, and because that will add to the doubt of things and kind of cloud your purpose and passion of why you want to go into this field. And so to all pre-meds out there, stick with the path, but stick to your own path and
Mhm.
trust that again you'll get there somewhere. I know I'm gonna get there someday, but it's truly your own path, not someone else's.
That's incredible. Thank you for sharing. I know
Yeah.
as a current pre-med myself, I can definitely relate. And that was a great way to put it, that everyone's journey is not yours. And
Hmm.
things that work out for other people may not work out for you, and vice versa. So thank you so much for sharing.
Yeah.
What gives you hope when you think about the future of healthcare? I know this is a super broad question, but kind of honing in on everything that you really want to carry on with you in the future of healthcare.
I think I have hope on what the potential might be. And I think I have hope in the passions and the purposes that people are starting to bring up into healthcare, like that of my own, and creating culture and creating more empathetic care. And
Mhm.
that genuinely brings me hope in a world in such of bad news, stuff like that. I think us as a collective of aspiring physicians, healthcare workers, nurses, physician assistants, medical assistants, even anyone in healthcare, we come in with the purpose of helping people and stays consistent and evaluating how we can help those people. It gets me excited, honestly.
Right.
It
Mm.
really does. It really does get me excited.
Great. Thank you so much. So,
Hmm.
before we wrap up, is there a final message you'd like to share with young people passionate about transforming healthcare?
I think my dog has a message too, for
Glad
sure.
you heard that one.
I'll give one that's sorry. She probably
No
saw
worries.
another like squirrel again or something. That's so funny. I'll give a piece of advice that my mentor tells me, but I've also heard it from different podcasts and stuff. For context, I'm a huge sports fanatic. I love sports, but even more nerdy, I love coaching. I
Okay.
love like legendary coaches. So if you know Nick Saban, John Wooden, I'll give some Ohio people too. Urban Meyer, the list goes on and on of coaches I truly admire.
Hmm.
But there's one, and he's not like a sports coach. He's actually like a sports journalism coach.
Hmm.
I forgot the name specifically, but there's a quote that he always shares, and it applies both to life and it applies both to healthcare as well. And it's this: it's treat normal people like superstars and treat superstars like normal people. And I think encapsulating that idea that we're all kind of the same, it breaks down barriers, it breaks down preconceived notions, and it truly fosters connection and how we are all the same.
Great. Thank you. Well, thank you, Jaden, for sharing your journey and showing us what it means to lead with empathy, purpose, and community. We hope today's conversation sparked reflection and affirmed that youth voices and mentors are essential to building a more just and responsive health system. If you're ready to take the next step, visit projectunitynfp.org or connect with changemakers, explore student led initiatives, or get involved with future episodes. I'm Hargun Sachar, and on behalf of Project Unity, thank you for listening. See you next time on On Call.